All righty, good afternoon, and welcome to today's virtual congressional briefing entitled Strengthening the Nation's Health Workforce, the Critical Role of Title VII Investments. My name is Kara Carruthers, and I serve as the president of the Physician Assistant Education Association, as well as I have the pleasure to serve as the Associate Program Director for the Developing PA program at Meharry Medical College. PAEA, the sponsor of this event, represents all 282 accredited PA education programs across the United States, which is responsible for graduating approximately 10,000 PAs every year. This briefing comes at a time of extraordinary challenges for our healthcare workforce, as the country has continued to grapple with COVID-19 surges and increased demands for mental health services. Clinicians are experiencing unprecedented pressure as they strive to deliver high quality care to patients. This pressure has contributed to increasing rates of burnout and provider shortages that has already been approaching crisis level pre-pandemic. As we recover or attempt to recover from the impact of COVID-19 on our nation's healthcare system, federal policy must play a role in ensuring that we have a robust and diverse healthcare workforce that is prepared to expand access to care, especially in historically underserviced communities. This will require Congress to leverage the success of health workforce development programs like the Title VII programs that strengthen curricula, provide financial aid to students, and secure training opportunities in underserviced areas. While these programs do critical work, current funding levels do not reflect the growing magnitude of the challenges we face in developing the future workforce. For example, at the most recent funding level, only 5 of our 282 PA programs were able to obtain an award under the Title VII Scholarships for Disadvantaged Students program. To meaningfully address barriers to students from groups underrepresented in medicine seeking to become health professionals, as well as other challenges, significant new investments in Title VII are essential. This is why PAEA endorses the recommendation of the Health Professions and Nursing Education Coalition, which calls for a $1.51 billion investment in appropriations for HRSA's Title VII and Title VIII programs, which is up from $799 million in FY22. Today, you will hear from our panelists about how they are utilizing those Title VII investments to increase the number of graduates practicing in primary care, strengthening the pipeline of students from groups underrepresented in medicine into the workforce, and facilitate high quality clinical training experiences in both rural and underserviced communities. We hope that their experiences will shed greater light in the true value of these programs as solutions for our future and current health workforce needs. Joining me today are Carolyn Bradley Guidry, an associate professor at the UT Southwestern PA program, as well as the Assistant Dean for Diversity, Inclusion, and Equity Affairs at UT Southwestern Medical Center, and former member of PAEA's Government Relations Steering Committee, and Nina Multag, Associate Dean and Randolph B. Mahoney Director of the University of Florida School of Physician Assistant Studies. Tyler Smith, PAEA's Director of Government Relations, will also join the conversation later as our moderator. Following their presentations, our panelists will be happy to answer any audience questions, which can be submitted in the Q&A box located at the bottom of your screen. Thank you again for joining us this afternoon and participating in this session. And I'll now invite Carolyn to begin with our first presentation.
Thank you so much, PA Carruthers. As previously noted, I'm Dr. Bradley Guidry, Associate Professor in the Physician Assistant Program at UT Southwestern Medical Center, and I serve as Assistant Dean for Diversity, Inclusion, and Equity Affairs in the School of Health Professions. In our brief time together this afternoon, I'll share an overview of UT Southwestern's PA program, as well as some of the outcomes of the Hersel Scholarship for Disadvantaged Students grant that we received in 2020. Next slide, please, Tyler. UT Southwestern's PA program was established in 1972 and has held true to its core values of maintaining a focus on primary care delivery to a diverse population. Our mission is to excel in the art and science of physician assistant education, to promote interprofessional primary health care to a diverse and dynamic population, to encourage leadership, service, and excellence among our faculty, staff, students, and graduates, and to foster a commitment to diversity and inclusion, evidence-based medicine, quality improvement, and patient safety. Next slide, please. In 2017, we developed a vision statement to publicly share the program's commitment to training a PA workforce that represents individuals from all backgrounds, particularly those considered disadvantaged. Disadvantage spans three categories: educational disadvantage, which includes individuals who are the first in their family to attend college; environmental, those that live in rural and underserved communities; and economic, referring to low socioeconomic status. Disadvantage is broad and irrespective of racial and ethnic composition. Our vision is to become a destination PA program for economically and environmentally disadvantaged faculty, staff, and students, while achieving and maintaining excellent outcome measures. Next slide, please. Our goal is to train a workforce that reflects a broad range of backgrounds within our state. We have a diverse faculty and staff, as you can see on the slide, that are dedicated and committed to training the next generation of outstanding physician assistants. Our faculty and staff consists of diversity of race, ethnicity, age, gender, sexuality, religion, veteran status, as well as socioeconomic status. We understand that diversity fosters inclusivity and creates a robust work and learning environment. Next slide, please. Our 30-month curriculum is designed to give students the knowledge and skills and confidence to care for a wide range of patients in various settings. We utilize the competence for the physician assistant profession as the foundation for our educational objectives. These competencies fall in 6 broad categories: medical knowledge, interprofessional communication skills, patient care, professionalism, practice-based learning and improvement, and system-based practice. Our 15-month didactic curriculum concentrates on basic sciences, professional practice issues, evidence-based medicine, clinical medicine and clinical skills, pharmacology, clinical prevention and population health, where we have emphasis on social determinants of health and psychiatry. These core classes prepare our students for clinical rotations that occur in the next 15 months of their curriculum. And they rotate in internal medicine, family medicine, infectious disease, women's health, pediatrics, psychiatry, surgery, and culminate with an 8-week primary care preceptorship, again, aligning with our mission. Next slide, please. Our program is ranked number 7, according to the US World News Report. And Texas has the largest amount of underserved and uninsured individuals in the country. So with a focus on primary care, our top priority is to educate and train a diverse, culturally competent PA workforce that are prepared to provide high quality care so that biases and disparities are minimized. Next slide, please. This slide demonstrates the characteristics of our cohort for the last 5 years. On the x-axis, you see the year that our student was enrolled and the number of students enrolled that year. And on the y-axis, you see the percentage of underrepresented minority students and students from disadvantaged backgrounds in that particular year. So you can see we have been intentional and we have consistently increased and diversified the PA workforce. From 2017, we had 25% of our students that was underrepresented in medicine. By 2021, that number is up to 53%. The same for disadvantaged backgrounds, 22% in 2017 and 78% by 2021. Next slide, advance, please. So we've seen a 56% increase in the number of students that we have enrolled over the last 5 years from disadvantaged backgrounds, and a 28% of those individuals that are underrepresented in medicine. Next slide, please. You can imagine in advancing that degree of diversity within our program, for both racial and ethnic diversity and individuals from disadvantaged backgrounds, we realized that our students were challenged financially and had significant problems that could be barriers to them receiving their degree and getting into the workforce. So in 2020, we applied for and was awarded the HRSA Scholarship for Disadvantaged Students. Advance, please. We decided to title our grant Healthcare Resilience Scholarship Award, to use the same acronym for HRSA, but not label our students within our cohort as disadvantaged. Next slide, please. So our core HRSA team consists of myself as the project director. Assistant Professor Veronica Coleman is our recruitment and retention specialist, and she serves as our director of admissions for our program. Our staff member, Ms. Estela Perez, is our data specialist, and we couldn't do any of this with funding without Ms. Duchess Ingram, the associate director in the Office of Student Financial Aid. This is our core HRSA team that maintains the day-to-day operations in support of our students. Next slide, please. So what are our program goals? We set out to reduce the financial burden and provide scholarships to our growing number of disadvantaged students, to enhance recruitment of disadvantaged students, increase the number of underrepresented minority students, retain both disadvantaged and underrepresented minority students, and increase the number of graduates working in primary care in medically underserved areas. Next slide, please. Our project objectives was to provide at least 24 scholarships annually to students from disadvantaged backgrounds, to increase the number of students enrolled from disadvantaged backgrounds by 10% by the end of our project period, which is a 5-year time span, to retain at least 95% of students from both disadvantaged backgrounds and underrepresented minorities, to increase the number of PA program graduates working in both primary care and medically underserved areas by 10% by the end of our project period. Next slide, please. So what have we done? We have exceeded our projected scholarship awards of 24 scholarships per year. Our first fiscal year in 2020, we awarded 30 scholarships, and in 2021, in our second year, we awarded 33 scholarships. We've established an external stakeholder evaluation and advisory group that consists of administrators from our local health professions high school, our local community college, a historical Black college and university, Prairie View A&M University. We have primary care physicians on this advisory group, as well as local leaders within the community. We've developed an alumni ambassador program. We've enhanced our retention efforts. We've modified our existing mentoring program, increased our cultural competency implicit bias training of faculty, staff, and students, and added new clinical training sites in primary care and medically underserved communities, because we know immersive learning is critical for exposure and to pique the interest of students working in these communities and with these populations. Next slide, please. So this is a picture of our first cohort. Again, 30 students instead of 24. Next slide, please. So where are these students working? So of those 30 students, 15 have graduated. We have 7 that graduated in the cohort of 2020. 71% of those students are working in medically underserved communities, and 50% are working in primary care. We had 8 to graduate last year in the cohort of 2021. 75% of those students are in medically underserved communities, and 25% are in primary care. So I want you to stop and take a pause for a moment and think about one graduate. We have 15, but think about one graduate working in medically underserved and primary care areas. And if one PA sees on average about 15 patients per day, which most see more than that, at the end of a week, they're seeing 75 patients. At the end of a month, that's 300 lives that they're touching. At the end of 1 year, there's 3,600 patients that one graduate can impact. The funding from this particular scholarship has allowed us to educate more students than we anticipated that will be going into these primary care areas and underserved communities and impacting the lives of our state's most vulnerable populations. Next slide, please. So you've heard our outcomes. I want to share some reflections from 4 of our students. And this is how this scholarship has actually impacted them. Student number 1, this scholarship doesn't change your day, week, or year. It changes your life. In 20 or 30 years, it will still have an impact. This particular student wants to work closely with inmates in order to help them with medical and psychological issues. Student number 2, personal reflection. Working in a rural community means I'll be able to form bonds with my patients and get to know them, which I feel is important in a patient-provider relationship. I'm grateful that this scholarship will remove some of the financial burden of my studies. Next slide, please. Reflection number 3. One of the reasons that I chose UT Southwestern was because of their commitment to underserved and diverse communities. The scholarship is a real example of the program's dedication to providing care to all patients. And lastly, student number 4. Thank you so much for the scholarship. It means a lot to me and my family. I'm very grateful. I did not know how I was going to pay for school and was terrified at the thought of taking out innumerable amounts of loans. So you see, this scholarship is impactful, not only for students, but for the future patients and also for diversifying the PA workforce. Thank you so much for your time. And I'm going to turn it over to Nina to continue from here.
Good afternoon, everybody. Thank you, PAEA President Kara Carruthers and Dr. Carolyn Bradley Goodry. My name is Dr. Nina Maltak. I'm a professor, associate dean, and program director for the School of PA Studies at the University of Florida. Next slide, please. So we're located in north central Florida, about 75 miles southeast of Jacksonville and about 100 miles north of Orlando, Florida. One of the really interesting things that I'm going to talk about is how our AHEC, our Area Health Education Centers, partner with universities in the country and particularly in the state of Florida and our School of PA Studies to support PA student training and PAs who would like to practice in primary care and impact patients' lives in the way that Dr. Bradley Goodry has shared moments ago. So an interesting notes about our location is that our Health Science Center is located in the center of that image to your left. And as you see, a lot of buildings on one part of our campus in the University of Florida. You see a lot of green trees in the surrounding areas. The green trees really represent where we're in a city of 132,000 population, and of that, 62,000 and change are students. So the remaining population is the poorest in the state of Florida. And as a matter of fact, there's a 30% poverty rate among those who live in our surrounding areas. And we really have been appreciative of the opportunity to connect with the AHEC to support training for PAs and other healthcare provider students to serve the locals who inhabit our community, teach them how to support their own health as they move through their life. And we have 6 health center schools. We have the College of Medicine, where the PA school is. We have dental, vet med, public health, nursing, and other public health professions. And we all work together to support primary health training of our local community. The picture on the right is the building where the College of Medicine and the PA students spend their days learning and participating in experiential learning. Next slide, please. So we have a long-standing history. This year, the School of PA Studies at the University of Florida celebrates 50 years, much like PAEA. We were the first in our PA school in the state. And like Texas, we have quite a number of PA schools at this point. But since 1972, we've been training PA students in collaboration with the area health education centers. And we are just really proud of the collaboration with the other colleges in the health center that are supported by the area health education centers. Next slide, please. So like UT Southwestern and many of the other schools of PA studies, our mission is to support the people of our state and around the country and globally as well in a multi-professional healthcare team and in a diverse and ever-changing healthcare environment. Some of our core values in our School of PA Studies include excellence, integrity, diversity, compassion, and service. And one of our unique features of our students who come to study here at the University of Florida is their dedication to service. We know that they've been altruistic and care about making a difference in the lives of others in their community, even before they want to become healthcare providers. And so when we take a look at those who we want to train to serve primary care patients, we really value this, this core value among the others there. Next slide, please. One of the interesting things at the University of Florida is that we aren't as privileged to have scholarships for our students. We do have some opportunities for educationally challenged students who are the first in their family to come to college, and that's supported by the state of Florida system as well as the university leadership. And so we're privileged that we have many of those individuals who apply to become PAs. We have great opportunities for our students to get practice in the core skills involved in primary care service from early on. And each course is built and scaffolded in a way that enhances this experiential learning to best serve our primary care residents locally and in the surrounding community, as well as across the state once they go out on their clinical rotations. Next slide, please. Our curriculum is a little bit on the shorter side. We have a 24-month curriculum. The mean for all School of PA Studies is 27 months. And our curriculum is established in a very interesting way. Our core courses, the basic sciences, our physical diagnosis, and clinical skills courses are what comprises our first 12 months of our didactic or our academic component of the curriculum. And our second 12 months of our 24-month curriculum is composed of 12 one-month rotations, 2 of which are in primary care, which further emphasizes our responsibility to serve the needs of our state and our local community. Next slide, please. One of the things that I do want to share is over the course of the 24 months, we incorporate health system science into our curriculum. And this is done by a variety of ways. We really value team-based learning, and although we don't have a traditionally team-based curriculum, we really take advantage of the interprofessional opportunities that are available to our students. The very first course that our students take is anatomy. We're very fortunate to have a cadaver anatomy course, and the image on the right are our students pre-pandemic with our beloved anatomy professors. And from day one of the curriculum, they're taught about patient-centered care, patient safety, healthcare delivery systems, social determinants of health, all the things that comprise a health system science curriculum. We grow it every year. We're really delighted to have the support. And our anatomy professor, one of the things he does is has a remembrance service at the end of the course for our body donors. And for that, he attributes the cultural distinguishing features of each of the individuals who donated their bodies so that the PA students could learn how to appreciate cultural differences from the beginning of their course, even though they were unable to speak to their patients, these first patients of theirs. Next slide, please. We infuse this health system science approach through all our curriculum, and this helps us prepare our students for their clinical learning experiences. On the left, you'll see a group of our PA students in front of our mobile outreach bus, and that's one location where students can practice what they've learned, practice approaches to health system science. In that bus, it is staffed by one PA, one nurse, and our students go there to support the local community members who do not have access to healthcare. This bus is primarily student run, primarily PAs and PA student run. We have other equal access clinics in the community, actually 5 others where we have pre-pandemic, they were in local churches and supported by AHEC staff. Currently, they are located in the tents in the parking lots of the local churches in our outlying community. And these are ways that our students provide primary care services early in their career. As you'll see in the other 2 images, we provide experiential learning opportunities through task training. The middle oval is student learning ultrasound techniques, and on the far right, a student is learning airway management skills. And one of the things that we have done while we practice on task trainers and patient actors before live patients, we have task trainers and mannequins that are of all different shades of the rainbow to give students access and experience in learning what skin conditions and other healthcare conditions look like on various members of our population and our community. Next slide, please. We also have a really robust network and mentoring opportunity with our graduates. We have so many opportunities for our students to practice with the support of our mentoring network, including our AHEC partners, to prepare our students for practicing and taking great care of our patients in the primary health care settings, as well as the inpatient. But one of the things I wanted to highlight by this slide is to show you that we really rely on a community of people to support our students and train them to hit the ground running when they're able to take care of patients. Next slide, please. Every year we have a dedicated group who's interested in primary care. I'm proud to show you this slide of our 2021 National Health Service Corps PA Scholars. They come from various backgrounds, and from day one of their PA training, they have committed their career to a service in primary care. If there were more scholarships to go around, we would be so delighted, because not only do we have this core group of 6, which is pretty large for a National Health Service Corps scholar group in a PA program, but once many of the students come in, the National Health Service Corps has just opened their applications for 2022. And students are scrambling for my signature and others to assure their eligibility. And also our students who will come in June, the next cohort, have heard about the impact that our National Health Service Corps scholars make on the lives of their patients. And we have a lot of excitement for participating and assuring that they're eligible to become these kind of scholars, and many interested in dedicating their lives to serving primary care or patients in primary care settings in rural and underserved areas. Next slide, please. I want to talk a little bit more about the AHEC, the Area Health Education Centers in Florida. It's very strong in Florida, and each region of Florida has a different AHEC that is assigned to partnering with a university that's located in the area. The University of Florida in Gainesville is located just around the top of that letter E in that slide. And so we are lucky to be supported and have a longstanding history with our local AHEC. Next slide, please. So one of the functions of an AHEC is to build a bridge between the local universities, local education centers, and the community. And they do act as a bridge between the health education institutions and community partners. And we have 10 in Florida. And over the last 10 years, they've really strengthened the partnership between the community and the educational institutions in the state of Florida. And one of the big things that we've seen in our work with them in the last several years is developing educational content for practicing clinicians. And this has been a really exciting initiative to be part of as a faculty. Several of our faculty have been involved in it, and our students have reaped the benefits, as well as our alumni. Next slide, please. So I was telling the other participants about this slide. The image on this slide on the left comes from a plaque that was given to us in 1988 by the Suwannee River Area Health Education Center. And I had to do a little research ahead of this talk to find out exactly what that barn was. I took a look. I was wondering if there was a tractor inside. I didn't know if that's where they invited the students to sleep, because in the olden days, the AHECs provided housing with the local residents for the students to come and help care for the patients in the local area. We didn't know if that's where the doctor provided care for the patients, but it turns out this was land donated by a farmer. That's where his barn stood. That's now the site of the Area Health Education Center, and behind it is the Suwannee River. You may be familiar with the song about way down upon the Suwannee River. That runs right behind that land where students from the University of Florida School of PA Studies partner with the local providers to learn how to learn about the needs of the local patients and identify how to best help them. One of the pictures I've been a PA educator for a number of years, and one of the great pictures I got last year was from that AHEC site, where one of my former graduates was a preceptor for a current student, and the student texted me a picture of a gift he got from his patient that he had helped. And the patient, on the second visit with the student, brought him a watermelon from his backyard, and the student laid the watermelon next to the dog, and the watermelon was as big as his mid-sized dog, and it was just a small token of appreciation from the patient, but it just highlights the wonderful relationship and the relationships that our students and our alumni build with the patients who they serve in primary care settings. Next slide, please. All right, this got a little cut off on the side, but I wanted to really highlight in an old school way. This is how we have kept our records. We've had a relationship with the local Florida AHECs, 5 of them since 1995, possibly earlier. But as I was preparing for today, I could track the records back to 1995, which is when I think we first had a computer here to track the numbers of students we sent on rotations. We've had relationships with the Swanee River AHEC, Northeast Florida AHEC, the Big Bend AHEC, which is where Tallahassee is, the Bend in the state of Florida, West Florida AHEC, which is in the panhandle of Florida, just south of Alabama, and Gulf Coast South AHEC, which is on the Gulf side of Florida, a little bit southeast of Orlando in Tampa, south of Tampa area. So if you look, I tend to read this from the right to the left, but if you see the total number of AHEC rotations per student, we started out at 36 clinical rotations when we had 30 students. We're now up to 60. We peaked at nearly, in the early 2000s, we had every student doing 2 AHEC rotations, 2 rural and underserved area rotations for every student. Since the pandemic, just before the pandemic, we had 1 clinical rotation per AHEC site, and now about 50% of our students have the ability to go to a clinical rotation site. And if there's anything I want to impact on you, support for Title VII funding will strengthen the AHECs, provide a network of providers to work in the area health education centers to help train our next generation of healthcare providers. And it's so important for us to have your support with this, because training in a rural and underserved area to the patients makes all the difference in the decision for students to go into primary care as a profession. And having these opportunities would be the best way that we can support ample healthcare to patients in need in these areas. So we all appreciate your support in this area. Thanks. And next slide, please. I want to highlight another, while the AHEC supported us through clinical training sites initially, in the last decade, they've really evolved the interprofessional offering. So we have opportunities for our first-year students to learn what interprofessional care looks like with members of the local community as our patients. One of the most valuable experience our students have is called Putting Families First, where we recruit family members from the community, not associated with the university, to have our students, our interprofessional student groups, meet with them. Before the pandemic, we went to their homes, to the patients' homes, to learn about the patients, what impacted their ability to lead a healthy life, and help them to achieve that. We're in an area of Florida, we don't have a large percentage of seniors like the southern part of Florida does, so we have patients who span the age range, and students learned how to help patients manage their diabetes, learn how to help them have healthy dietary habits, and assisted in learning how to help them be more mobile, more active, and for some of our patients stop smoking. So our curriculum begins in the summertime, and once a month, our student groups, we have groups of 20. We have about 1,500 healthcare provider students on campus here, and they meet. We have about, I want to say 70, 40. We have about 300 families that participate. And so once a month, a group of students visits our patients in the homes, and Putting Families First, learning what patient-centered care means, and understanding the challenges that surround the ability of patients to get optimal health care, and for them to learn how to be providers and provide patients with support services for that. One of the other initiatives supported by the AHEC is the Interprofessional Learning in Healthcare, which is predominantly a smoking cessation program. And it also helps students arm themselves with services to give to their patients, among their first patients there. And the third program supported by the AHEC is the Summer Health Professions programs, where students with a minimum of a 2.0 GPA and are from underserved communities apply to spend 6 weeks on campus here with us at the University of Florida, exploring the various health profession programs and learning about what it means to be a PA and other types of healthcare providers. So we spend 6 weeks with experiential learning. Our students and our faculty mentor these young high school students to help them understand what a day in the life of a PA is, and also the dental students have those interested in, and the other health profession students mentor the high school students to help them understand what it means to be a healthcare provider in each of these professions. We have several PA students who've matriculated from starting in that program. Next slide, please. One of the other initiatives of the AHEC is the opioid training. And as I alluded to a few moments ago, this is a partnership with the local community providers and the institution to provide training for students to recognize opioid addiction, opioid abuse, to prevent more overall morbidity and mortality, and for graduates of our program and PAs across the state to have continuing opportunities for continuing medical education to help reduce the statewide morbidity and mortality associated with opioid use and addiction through interventions that are a collaboration between the University of Florida, the local AHEC, and our community partners. It's been very impactful, and it's integrated in all 67 counties of Florida, and PA students around the state participate. Next slide, please. The last initiative that we partner with the AHEC about is our smoking cessation program. We have an interprofessional approach to this as well. This is something that our students participate in while they're in the first part, their academic or didactic phase of their curriculum, as well as while they're on their clinical rotations around the state. And so they help design initiatives. Currently, they're using social media outreach to encourage patients and other students about how to stop smoking or strategies to help that. The courses are in person, socially distanced, of course, as well as virtual. And these students, the PA students, along with the other healthcare provider students and the AHEC, also support the initiatives for the University of Florida and the other state university tobacco-free campus initiatives. And so it's been a real delight. These are the formal outreaches. During the pandemic, during the heart of the pandemic, students have also received support with the AHECs for COVID testing as well as immunization. But I hope this helps you understand the impact that practice-based learning with the AHEC as a huge supporter has extended the training of our students, has extended the support and the ability of the university for us as a School of PA Studies to train our students. With them, patient education initiatives have been incredibly robust. The clinical training sites have been robust. And we look forward to additional long-standing relationships with our community partners and especially our AHECs. And we hope this gives you a little insight into the importance and the impact of the AHECs with the PA schools, PA programs, and PA students. I believe that's the last slide. And with that, I want to thank everybody and turn the webinar to Tyler Smith for questions and answers.
Absolutely. Well, thank you so much, Dina and Carolyn, for your excellent presentations. As Kara mentioned earlier, my name is Tyler Smith, and I'm the Senior Director of Government Relations for the PA Education Association. And I will be serving as the moderator for the Q&A session, which will wrap up our discussion today. So just as a reminder, if you have questions, please feel free to enter them in the Q&A box at the bottom of your screen. So it looks like we do have one question that's come in thus far. They say, I would like to hear more about how you proceeded with the application process, i.e. how much time was allotted, who completed the application, etc. We would very much like to move forward with these initiatives. However, we are finding that faculty and staff time and learning curve for the grant application process is the greatest barrier for moving forward. So I think, Carolyn, that one is directed to you since you're administering SDS directly.
All right, thank you, Tyler, and thank you for that question. One resource for faculty training, I would like to put in a plug for the Government Relations Steering Committee at PAEA. They actually have an annual workshop that you can participate in and learn the grant writing skills, and they have specific workshops targeted toward writing for HRSA awards. As far as the amount of time, I think the most important thing is your data collection. When we apply for this, and you have to be able to show trends of your outcomes. When we applied for the HRSA grant in 2020, we used data for the last 3 years. And if you could, on the slide that I showed, our projected increase in students from disadvantaged backgrounds and students that was underrepresented minority. I also had trends of our students that were going into primary care. And so if you already have that data and you're tracking your data beforehand, that makes the writing process a little bit easier, but it takes a team. You can't write a HRSA grant with just one person. I consulted with our previous director of our AHAC here locally. She and I, Dr. Laura Milner, she and I have worked on previous projects together. It takes a team and with this data processing and being able to keep up with your numbers so that you can then write to it. Time-wise, I would say, generally we keep the data on board ongoing, but it takes at least a good 3 weeks nonstop, just thrust in making sure that you're meeting all of the requirements of what the grant has asked for. And then you got to seek out partnerships. I put our associate director of financial aid on there. When this grant application period opened up, I went straight to the financial aid office to learn their award processes so that I could then include that in the grant. So time-wise, I would say, 3 to 4 weeks of undedicated time where you just focus, of dedicated time where you're focusing this. But it helps if you already have your data. If you're not tracking data, it's going to be pretty challenging to be able to apply for one of these awards.
Thank you, Carolyn.
You're welcome.
So a couple of questions that I had, we have talked a lot over the course of this presentation about trying to get more graduates into primary care and in rural and underserved areas. This has been an area of challenge for decades and really the focus of a lot of the Title VII programs in particular. So this next question, which is for everybody on the panel, is what are the most important factors that you see with your students that are impacting their decision on whether to go into primary care or another specialty or to practice in a rural or a more affluent community?
So I'll start with this one, and it is the burden of education, burden of training. So while our profession did start because of a great need for clinicians in primary care back in the mid 1960s, that was the impetus for it. That really is the foundation of our profession. But the reality is the cost of being educated, particularly in the medical space, has increased tremendously. And so investment in Title VII programs, such as the HRSA grants, that is what assists our students who have a desire to work in underserviced areas, to work in primary care, to live in rural areas, because many of them do come from those areas and have family there. It literally is the cost. And knowing, hey, I had to take out this amount of debt for PA school, and I want to pay it off as quickly as I can and yet be able to provide for myself and pay this debt off. And so that really is what precludes many of them into going into primary care or going into areas where the pay may not be as much as in a more suburban or urban area. And so by this increased investment in Title VII, that allows the 282 PA programs to award more scholarships to defray the cost of education. And we know from our medicine colleagues, AAMC and IOM, we know from them that students that are underrepresented in medicine or are from underserviced areas, if they have support, it's something like 60% of them will go back and work in primary care and in underserviced areas if they have the financial support. And that is where the increase in Title VII funding comes in to assist us.
I would agree, Kara, with everything that you've just mentioned. I think you really highlighted the essential challenges for students. And I just wanted to share for the attendees that not only the cost of PA school attendance, but most of our PA students come to us with undergraduate loans, and some of them exceed $200,000. And so once they have PA school debts, if they have a PA school debt on top of those undergraduate loans, you know, particularly if they're the first in their, you know, first generation to go to college, that the idea of, you know, and strategies for paying off their loans as quickly as possible are really high on their radar, and having support, you know, for these programs will enhance their choice to return back to the communities they come from to provide primary care services.
And I would just like to add, I agree with what both Kara and Nina has stated, and I would just like to add that Title VII funding can also assist. There's different kinds of grants that Title VII supports that actually supports expanding clinical training sites for our learners. So there's a financial burden, and then there's the clinical training sites. And we also know that our students that go into an immersive learning experience where they are exposed to those populations are more likely as well to continue to work in those populations. So again, Title VII funding to support the development and expansion of clinical training sites in primary care, rural and underserved areas, as well as supporting the funding for students to continue their education into health professions.
So it looks like we have two additional questions that have come in, and they're both related to your award, I believe, Carolyn. So the first question is, has any of your award money been able to be used to compensate clinical preceptors? And then also, is there a mandatory commitment to work in primary care for students who receive an award under the program?
So all of the money that we have received have gone 100% to scholarships to fund the students. So no money to clinical training sites. All of the money have been utilized to offset the financial burden of the learner. And as far as, is it mandatory? It is not mandatory, it is encouraged. But again, we've placed students in these learning environments and they have enjoyed it, and they have elected to continue a career in these areas to give back. Just like Kara stated earlier, the data shows us that students, if you get these students from these disadvantaged backgrounds, they're more than likely to give back. And if you can create an opportunity where their cost of tuition is reduced by these scholarships, and then they go back, so they have a reduced financial burden, and they're going back into their communities to serve. And that's why our percentages are so high for those graduates that are going back into these areas. They want to give back to the communities that they've come from because they've lived it, they've experienced it, and they want to make a difference in their own communities.
Absolutely. So the subject of clinical training sites and payment has come up a number of times over the course of our conversation, and for good reason, right? Finding clinical training sites, especially those that are willing to train students on a volunteer basis, has become more and more of a difficulty for programs. So I was hoping to see if you all could weigh in on what you really see as the long-term implications of federal policy not addressing clinical site shortages.
So are you asking us if there is not intervention to assist us as educators, will we continue to have to pay for clinical sites?
Exactly.
Yes.
Yes.
That truly is the trend. You know, we are fortunate that some of our programs do have relationships with the VA, and we're able to have our students rotate there. And that's then it is not a barrier, but not every PA program has an opportunity or has access to a VA in their community, and that may not be an option for a training site. But the numbers have increased. I will say for sure the last 5 years, the percentage of PA programs that are having to pay for clinical sites have increased. We have also seen that go up more because of the COVID pandemic and some of the lack of access, willingness to have students in non-essential, who's dubbed non-essential into hospital settings or clinical settings. And so that has also accelerated this. So if this trend continues and if the current climate continues, I'll say it that way, we will continue to see PA programs having to set aside budgetary funding to pay for clinical sites. And at this point, it's not regulated, right? So one clinical site may say, well, I need $2,000 per student. Another one may say 500. And so that then also is a challenge for PA programs that have a finite amount of funding. And again, because we're very conscious of the cost of PA education for our students, we can't continue to just pass that on to them, because then we're missing those underserviced communities, students that come from those communities. We're missing those students that are from groups that are underrepresented in medicine. The more and more the cost of PA training and education becomes.
Nina or Carolyn, anything you wanted to add to that?
I would just echo that procuring ample amounts of clinical training site is important. Many of the healthcare providers who act as mentors or preceptors to PA students are non-compensated. They do it out of the kindness of their heart or for continuing medical education. They want to impact the next generation of healthcare providers. And often it's not they who are discontinuing becoming preceptors and providing clinical training. As Kara mentioned, it's often the institution that they're affiliated with, and there's fewer and fewer opportunities where the institutions have laid off some of the other healthcare providers. So the ones who've acted as our preceptors have more responsibilities, and it becomes really hard. And unlike nursing, who is counting simulated patient encounters as part of the clinical training for graduate level nurses and doctoral level nurses, that's not the case for our profession. So we really need to maintain and sustain ample clinical training in order to provide the best possible outcomes for our patients through our student training.
Tyler, the only thing I agree with both statements that have been made. The only thing I like to add is, if we don't have continued funding in Title VII, Kara alluded to this earlier, it's going to create more programs having to pay for clinical sites. That burden is going to be offloaded onto our students. Mm-hmm. And I think when that cost tuition goes up, it's going to significantly impact workforce diversity, when we're working diligently now to make an impact in that area and train providers that represent the demographic of our nation. If we don't have Title VII funding to expand our clinical sites and to continue our scholarship opportunities, that's going to have an adverse effect on the providers that we're able to educate and train and put into the workforce.
Absolutely. Well, with that, it looks like we are just at about time. So I'd like to thank all of our panelists for their excellent presentations today. I think it always helps when we're able to facilitate opportunities like this for you all to connect with congressional staff and external stakeholders. So thank you once again. The recording and slides of this session will be shared with all registrants shortly after this event. So thank you again to the panelists. Thank you to the attendees. If you have any questions, please feel free to contact me at tsmith@paeaonline.org. And with that, thank you again and have a great afternoon.